Let me introduce to you the moderator, and she will then go ahead and introduce the panelists. Moderator is Catherine Waldron. Catherine is the Chief Operating Officer for the National Healthcare Information Sharing and Analysis Center, or NHI-SAC. The NHI-SAC is nationally recognized by the DHS, HHS, and the National Council of ISSACs. The nonprofit organization is focused on information sharing and threat and vulnerability monitoring for the nation's healthcare and public health sector. So if you would go ahead and welcome Catherine and the panelists to our podium this afternoon.
As Bo said, we're talking today for about an hour on managing your business associates under the new omnibus rules. So each of the panelists have come up with a question that we think is pertinent, and they're going to kind of spearhead that discussion amongst the panelists. And then hopefully we'll have time at the end to have a discussion amongst the audience and answer any of your questions. So what we're hoping today is to maybe not answer all your questions on BAA, but certainly at least some of them. To my near left is Jennifer Papp, and she's the privacy officer for the LA County Department of Health Services, which is the second largest health system in the US and provides health services to about 700,000 unique patients annually. She oversees the department's privacy and security compliance program and guides the facility privacy and information security coordinators to ensure compliance. She has more than 25 years of healthcare management and clinical experience. Thank you. To her left is Michelle Caswell, who is a healthcare compliance consultant for Sword and Shield Enterprise Security. She has more than 12 years of experience in the healthcare field. She is a licensed attorney in Georgia, and she came all the way from Tennessee. Thank you. She provides in-house counsel services to Sword and Shield, and has worked as a HIPAA investigator for OCR. So I'm sure she has a lot of good stories. So thank you. To her left is Maria Suarez, who is the ISO at the University of Southern California. And that includes all the campuses across 8 international locations spanning across 4 continents. And she was previously the ISO at the City of Hope Research and National Cancer Center in Duarte, is that right? Duarte, California. Responsible for expanding the information security program at the enterprise level. She was also recognized as one of Computer World's premier 100 IT professionals in January 2005. And to her left, a woman who needs no introduction at this point, but I'm happy to give another one if you like. Okay. All right. Is Cynthia Stamer, who was kind enough to step in for Tom August, who is the CISO at Sharp, and he was unfortunately not able to make it. So while they're still getting the charts up, I'll just go ahead into the first question, and that's going to be for Jennifer. And that is, what are the changes to the BAA agreements under the new HIPAA rules?
Okay, so we heard a little bit about that from Peggy Lee this morning from OCR. And there's some confusion and some not so much confusion. So I'm just going to go over what the new rule, how it affects the BAAs. So as we know, the Omnibus Rule was published by the Department of Health and Human Services in January of 2013, and it finalized the changes to the privacy, security, enforcement, and breach notification from the interim rule under HIPAA and HITECH. So how does the new rule affect business associates? First, the Omnibus broadens the definition of business associates. Second, it clarifies which requirements and liabilities pertain to the business associates. And lastly, it extends OCR's jurisdiction and enforcement over business associates, contractors, and subcontractors. So the new definition under the rule is that any business, contractor, individual, or subcontractor who creates, receives, maintains, or transmits PHI on behalf of the covered entity would be considered a business associate. The addition of maintains is important because it's going to add many organizations that are currently not covered under the business associate umbrella. And that specifically would be things like document storage organizations. The omnibus rule also specifically identifies business associates, patient safety organizations, health information organizations like your HIEs, e-prescribing gateways, mail order prescription companies, and vendors of personal health records that provide services on behalf of the covered entity. Okay, go ahead.
Thank you. Now we're going to have the other panelists talk a few moments about this issue. Thanks.
Okay, let me think here for one quick second. So I guess what most people are, is this on?
Can everybody hear?
Okay, I think we're on. You know, I know there's a lot of fear amongst folks right now of what's going on with the new business associates and subcontractors. But coming from OCR 10 months ago and now in the consulting field, I try to put people a little bit at ease. And, you know, some of these things, if you're looking at your business associate agreements prior to the omnibus provisions, you have a lot of what we're going to talk about a little bit later. A lot of these requirements already in place. So a lot of this isn't going to be new language that you're dealing with. What mostly changed with the omnibus provision, of course, is the liability of business associates and subcontractors to OCR. However, I always tell folks, you know, if you're looking at a business associate agreement and you're a covered entity, I bet you anything your business associate told you they were going to comply with the security rule, they were doing their risk assessments, they were doing their policies and procedures. So I have a feeling that everyone should have already been doing this. Now there's actual force to state that your business associate must. And again, this changed as well with business associates in relation to their subcontractors as well. So those same provisions, that relationship between the CE and the BA, now apply to the BA and the subcontractor. So don't fear it too much. I think a lot of you already know what's in place.
We know today that information, sensitive information, is shared with computer companies that host various different technical services. So the question is, if your BAA was robust enough already to have obligations stipulated to those entities, you're probably okay. But we'll talk a little bit later about some other details that you should consider if you don't have those in your BAA, so that you make the subcontractors aware, or I should say your contractors aware that they're responsible for the subcontractors as well, and the specific topics that you're expecting them to address.
When this was first done, people globbed on the provisions and they just put the recitals in, and that was never the intent of OCR. And so we talk about names not being filled out and these other things. But when you stick these provisions on top of the standard data contracts or services contracts, those contracts already have provisions about data ownership, access, termination, use, a whole bunch of other things, as well as indemnification, reporting, other things. And so what we find in the enforcement and problem process is that even if you wrote all the things in that in theory you were supposed to have because you checked the box, you're not sure which of those provisions control, and there's problems in getting data back because you haven't defined ownership, you have problems in doing investigations, there's not timing on notices. So what I'm inviting clients to do is, with the benefit of what's now been, you know, about a very long period of history, is to look back and actually treat this as an integrated part of their services agreement, which was what was always intended and which is where the problems are. And so, so that your BA agreement confidentiality provisions should be an integrated special part of your overall confidentiality ownership, and it's a living part of your services contract. It is not an afterthought, it is not an add-on, and it's not something that sits out in divorce space. And if that's what you have, you got a lot of work to do. If you've really worked through and made data control, use, and ownership a core part, you'll be fine because you've probably already done 80% of it. And in that process, I go back to the comments I made this morning, which is it's not just about HIPAA. You really need to talk about ownership, use, and access protection and compliance as an integrated process with all of the data needs you have, not just part of it.
Okay, so the next question for Michelle. What should be in your BAA contractual agreements?
And this, I'm sure Cynthia's going to have some on this as well, but this is what I stated earlier as you already have as a covered entity, and again, we're going to speak to business associates as well. The provisions apply to business associates the same way as covered entities now. But if you're a covered entity, you likely already have these BAAs in place. And prior to the omnibus rule, what was required under to be included in your BAAs was that you receive satisfactory assurances from your BA that they would safeguard your PHI. And you did that in a multitude of ways, and I'm going to just peek at my notes because it's a lot. But for instance, establish permitted and required uses and disclosures, provide that the BA will not disclose more than what is minimum necessary, require your BA to assist you in providing access to your patients. So a list of about 11 laundry items have always been there in that satisfactory assurances provision under the rule. What's really changed under the rule is simply the fact that a business associate must include their agreement now that they will comply with the security provisions. Prior to the omnibus rule, I mean, if you look at your agreements, they said they were doing it, but when I would go on site with my covered entities and talk to the EMR provider, I would say, you know, give me your most recent risk assessment. And that EMR provider was like, well, I don't have to do a risk assessment. I'm not under OCR's jurisdiction. So I pull out that BAA and I said, well, you stated you were going to do it. So as CEs, this is going to give you more teeth to help make your BAA more receptive and responsible to implementing these safeguards. But aside from the requirements, I kind of wanted to just talk about a little bit of the optional elements that you can include. And as Cynthia was talking, you know, including an indemnification clause perhaps, whether or not your BAA includes a mitigation clause stating that your business associate will mitigate to the extent practical any harm that occurred. Do you want to have more stringent reporting timelines in your business associate, knowing now that breaches have to be reported in a more timely manner? Do you want to require business associates to, say, report to you in 20 days versus 30 days? So you're the master crafter of your agreement and try to figure out what's in that agreement that's going to assist you in compliance. And one more thing, this is piggybacking off Cynthia earlier. If you're dealing with a lot of statutory law, you're going to want to take a look at sometimes your most stringent law. Like if California is going to be more strict in their breach reporting standards, let's go ahead and draft it to that strict standard, and then everything else will fall underneath it.
Thank you. Maria, do you want to go next?
Yeah. I'd like to, so we say explicitly now that the law is requiring that they must, and whereas before they just attested that they would do it. What we're going to talk about a little bit later, I don't want to get into it now because it's going to come up in the next question, is what does that actually mean in terms of our responsibility of what we are communicating to them our expectation is. And I think we need to get a lot more specific about it. So we have the notification, uses and disclosures. We have probably right to monitor. There are certain basic things that are in your BAAs already. We're going to get into the next level of detail that of elements that should be added that are probably a bit more technical than saying access protections or saying we have a right to monitor or we have a request of, you know, for you to report to us when you have an incident. So keep that in mind as we go through this discussion, and we'd love to hear from you later on. So be thinking about what you're doing now.
Well, as you can see, I think it's a much more sophisticated process, and I think part of what you should look at in general, and it will help to solve itself, is if you go through item by item through your overall contracts, which tend to be sort of a contract and then a statement of work and then a something else, which they also should be added up together. But some thoughts. First of all, on mitigation clauses, not only do we want mitigation because it's a requirement in the statute, so we want to certainly carry as much of the rules downstream into the contracts, but I generally want to have a negotiated agreement about who controls the mitigation and what's acceptable. I don't think I agree with Michelle that we should take the highest standard, but I don't view it as optional. Your confluence of all of these requirements, contractual, statutory, regulatory, standard of care of negligence, and your contracts really need to require data protection, use, access, and disclosure to recognize all of those things. So all of the legal requirements kind of need to be incorporated in. I like to have cooperation with compliance, audit, investigation, defense, and mitigation. A lot of times now we're looking for insurance and remedies to help cover the cost of the investigation and rectification. I think just this whole question of who owns the data is really important, because one of the biggest issues we see is that you have jointly built databases, and a lot of times vendors presume that it's a work that they have for hire and that they own those data. And as a legal matter, they can't really own that data in some way, so it's embedded. So that's become a big point of dispute. I do think, and we're going to talk about this later, that you probably want some right to investigate because you get on notice of problems. So audit and investigation even before there's incident events. The question is how you're going to structure that, and what the costs and some of those other things. So, I mean, these are the kind of basic things that a lawyer thinks about when we do contracting, and whether you're a business associate or you're a covered entity, when you do those contracts in the wholesale well, you typically should be and probably are doing them in a much more comprehensive way. So again, I think try to look at your data confidentiality provisions, including HIPAA, as part of the broader contract and work top to bottom. And if you don't have a strong contract underlying it and it's not properly integrated, you probably have work to do and a problem that's waiting to bite you.
Jennifer?
They pretty much covered everything. I think we talked a little bit about considering cyber insurance and different types of insurance. Also, as Cindy was saying, incorporating specific elements into the actual contract rather than they being elements of an attached BAA agreement. Also, how are you going to handle directing that your business associates have business associate agreements with their subcontractors? And how are you going to know who those subcontractors are? Is that going to be a part of your contract where they provide you a list? When they change the subcontractor who's working with your information, how are you going to be notified?
Great, thank you. Can you press the button? Thank you. So following that is Maria, who will answer, do you have a security addendum listing specific security requirements as part of the business associate agreement, which is directly follows on with your last comment.
Yes. So we've always had, most likely, right to monitor. But as we get into some technologies like the cloud for storing, or whether it's maybe software as a service or some hosted system, when we get into technologies like mobile devices, and that includes laptop, and it also includes external drives, like those little USB thumb drives that are so fun to have, but also they're getting more and more able to contain more and more large sizes of information. So, 500 gigabyte external drives look pretty much like the size of your cell phone. And what do these things do to all the items that we've been saying to our BAs in our business associate agreements? So some things I'd like you to think about. We have to, yes, set the highest standards, because especially in California, we have 5-day accelerated notification. If we put our email in the cloud, for example, are there contractual arrangements to make sure that the information is, and maybe this is not a regulatory matter, but just a preference, that your information stays on servers that are geographically located within the United States? Do you have service level agreements that are going to help you specifically comply with the 5-day accelerated notification requirement in the state of California? And so these are things that we should be including in what I'd like to refer to this as security addendum. If you don't have it in your BAA, you don't have to go back and actually establish all new BAAs with your vendors, but you could start to develop a security addendum document that will have some of these additional specifics, and then when the contract is renewed, you can roll it into your BAA as part of the contract. There are things such as access protections that I'm sure you have in your BAAs expressed at some level, but do you differentiate between physical and logical controls? And are you including those aspects of USB thumb drives? Are they encrypted if they have PHI? Do you explicitly say in an encryption clause that all data, whether it be in transit or at rest, if it's going to move over a public network, needs to be encrypted? We do have to get this specific, I think, because some vendors are niche vendors, especially in the healthcare space, where they have found some function that hospital healthcare providers require to improve patient outcomes and patient care. And so we have a lot of smaller companies that start out as small and then they're very successful because they satisfy a particular need in the healthcare process. And so they become bigger and bigger and bigger. And we need to help them in a consultative way, communicate to them, make them aware of our expectations. Third-party audits. It's not just the right to monitor or the right to audit. We would like our contractors and subcontractors to say, yes, I have a periodic, at least once a year, some third party, which could be internal audit, maybe, if they're big enough and they have an internal audit department, to review our technical infrastructure and to tell us what our gaps are, maybe doing some penetration and attack testing. These are things that we are finding are not necessarily embedded, and understand that what I say here is from 20 years of experience and the last umpty years since HIPAA came out, the various places that I've worked, whether it be USC, City of Hope, Empire Blue Cross Blue Shield, it's always been a challenge to help communicate, help make aware through a very formally documented process what our expectation is of these business associates. That's our responsibility. For those of you that are more technical, think about all the things you have to do. Communicate it to your privacy officer, to your compliance officer. Make sure that these things get into the VAs.
Thank you. Cindy?
I like the idea of addendums in a lot of ways, and another process to ask about that, especially in many of the venues that we work in, is to think about doing an RFP that you incorporate all those details in and then incorporate the responses and the commitments by reference, because it's a much more structured way to do it that may be less disruptive for some people in this process. And one of the things that that I think can be useful about that is to be careful about just incorporating today's rules. So in general, when we write these things, we do a laundry list of nitpicky little writing all the rules in, and then we say, and you'll otherwise comply with all the evolving standards of care. And of course, if you're on the receiving side of that, if you're the vendor, you want to say, ooh, we're not going to do that. But in this case, we have a shared responsibility under the law. And so in addition to these addendums and these checklists, the checklists are going to constantly evolve by necessity. Also, contract to the expectations of a ethical process orientation that shows that they're partners in that commitment, and that it's not looking for the exception, but commitment to the concept.
Thank you. Jennifer?
So with whether you do an addendum or excuse me, or whether you're going through your business associate agreements because the contract is coming up, there are some compliance deadlines, and you do have an opportunity to have things grandfathered in if the contract is new after September 23rd, and then you can be grandfathered in for the 2014. But for us, most of our contracts are renewed annually, so we'll be probably redoing our business associate, but the idea of a security addendum is really good for, especially as we move through, as Cindy said as well, making sure that you have not only your HIPAA rules in there, but other types of security issues and laws that are being promulgated.
When we were talking about kind of the shared responsibility, I think that's important because I just as an example, last week I was at a cloud provider as one of my clients, and they wanted to say, well, when does my responsibility begin and when does my responsibility end? I can't control what my covered entity is going to do regarding access controls, encryption, mitigation, all that. So what I suggested, and it's a bit of a caveat to an addendum, is creating almost like a user guide that you can hand to your clients, whether you're the covered entity, whether you're the BA, to your subcontractor, that states what are your responsibilities under the security and privacy rule, and where does that end, and then where does your responsibilities pick up. We can build all these access controls into our software, but if the CE doesn't want to require unique user IDs and intricate passwords. By the way, I'm legal, not security, so I don't use some of the right terms. But so you have to think, though, you can say all you want that you've got these safeguards in your software or in place, but if the other end isn't doing that, are you held liable? Well, let's go ahead and educate our business associates. Let's educate our subcontractors on what they have to do to comply. Don't leave it up to them. And it could be as simple as handing them a brochure that says, here you go, here's your responsibilities. And that's the kind of things, too, you want to keep for that OCR investigation. You want to keep that documentation. I provided this to my business associate. They agreed to it. Just additional safeguards you can have in place in the event of an audit or a simple investigation.
Thank you. And now to bring it on home is Cindy. And what are the obligations of the CE to the BAA and their subcontractors?
Well, the law really talks about the obligations of the CE and the business associate to the individuals whose data they have. And so the obligations that we have between the CE to the BA in a legal technical sense are pretty illusory. But they're operationally real. Because remember, at the end of the day, the CE's head is on the block. So you can talk about all sorts of heavy-handed situations, but if the covered entity won't cooperate in their own compliance process, life will not be good. And so it's really more of an operational entity that always comes when you're the responsible party. And that is to responsibly pick your business partners, to work collaboratively and responsibly, because you really both do have liability. And if you are not committed, then you will not be able to protect yourself. The notion that you're going to offload this to some third party is a nice dream, but it doesn't happen. And at the end of the day, if you've done your job and your BA hasn't, if you're the covered entity, they might mitigate it if they can hold the BA responsible. But if they can't, or if they view that you weren't responsible, the problems we discussed will still come your way. And in that vein, I might just mention one other thought. I was listening to that, because I do use this concept of a shared responsibility. Michelle and I both do, because it really is a partnership. And in compliance in general, again, going back to the experience I have, it's no difference between kids, downstream organizations, employees in the workplace, agents. We set the tone when we're look at a problem and people are fearful that if they come to us with the bad news that they're going to be shot at the door. So this matter of fact, if you're responsible, we'll be responsible, we'll work through this together, business-like relationship, I think has to dominate. before the lawyers start throwing the crap around. It's important to be defensive, but when people get defensive, they let problems get out of hand. And so there's this constant problem where people see a problem and they don't want to confess that we really have no way to segregate this data, or we really, we heard about it, somebody's taken the data, but we heard a rumor, but we really didn't look under the lid, because we then would have to tell you these kinds of things. This communication of this process, and when you go through a process that matter-of-factly addresses problems together, reports them, investigates them jointly, and works together, if you do it properly, really does effectuate mitigation of risk for all parties and heads off the likelihood that you're going to have to crucify each other at the end. And that's what OCR and the laws are looking at. So when you're looking at negotiating the contract, remember that the tone of the relationship and how heavy-handed you are, and if you just say, well, we don't care, you have to commit. They very well may commit to get the business with no process to do that. And then when the inevitable happens, since they've been sitting fearfully in the corner waiting for mom to find out that they had a beer, that they're going to be afraid to come to you because you had discussions about it. That tone starts the first, the last, and that comes with you understanding what they can and can't do, and they understanding what you can and can't do, and being pragmatic about managing the responsibility before, during, and after. So the obligations of the CE to the BA and their subcontractors are whatever they contract to. The obligations of the CE and the BA to the third parties that they owe responsibility for protecting the data are not negotiable. They're just inevitable. And what we do within the contract is we allocate risk, cost, expense, and responsibility. And if you choose to take that on, or let me put it differently, if the BA chooses not to accept to have it, your choice is not to hire them. But if you commit to that obligation, in addition to whatever your statutory, regulatory, common law liability is, to the third parties for the consequences, you'll also be liable for that as well. And when you look at that, consider what you're already going to be liable for, to consider how heavy-handed you are, because if they're scared that you're going to leave them hanging, they'll hide, and your problem will be bigger, and it will hurt. So be fair, reasonable, and rational. That's my bottom line.
Jennifer?
With the CEs and their relationship with the BAAs, the CEs are ultimately going to be responsible for, what happens, and I don't mean that in the sense of, the monetary penalties or that sort of thing, but reputationally. So if you have a if you have a BA, a business associate that you've entered into a contract with, and a breach occurs, like Cindy said, you do need to really work together, because you need to resolve it, one, as quickly as possible, and also as equitable as possible from the standpoint of making sure that the patient's information is secured. So it's really important that you have that good relationship, and because sometimes some organizations end up in the local media, either on television or in the newspaper, and then things get blown out of proportion. So it's really important that you have good relationships with your business associates.
And it's not really, to repeat everyone what they're saying here, is more of this kind of marketing image. As Cynthia and Jennifer were stating, you can defer as a covered entity some of your privacy rule, not responsibilities, but requirements to your BAs. For instance, if there were a breach and you wanted your BA to notify the patients, you can say, you know what, under this contract, if there were a breach, I want you to notify my patients. But you have to kind of think of that from a marketing standpoint. My buddy's a privacy officer at St. Jude, and he asked me this question. And I said, what would your patients rather see? Would they rather see, Meditech breach my medical records, or would they rather see St. Jude's, contact information for St. Jude's, who can I speak with? That's who they have that relationship with. So, OCR might come in and find Meditech, and I'm just using that as an example, it's the first one that popped in my head, but ultimately that St. Jude's is, you already have that relationship with that patient, and do you really want to defer all those responsibilities to your BA? So you have to kind of think of it not just from the legal standpoint, but also your image and how you want to be portrayed to the community.
you have anything to add?
Talking about image and brand reputation, so I don't have anything to add. I think these ladies have covered all the legal aspects. I'd like to take us a little bit beyond that when we think about our contractors. And that is, we are, the healthcare, hospital industry is part of Homeland Security definition of critical infrastructure. The President of the United States signed an executive order requiring additional items to be done now. Legislation may or may not pass. Don't wait. Do what you know is right. Include it, even if it's not stipulated in HIPAA or the omnibus rule. You know what you need to do to protect your information. Do it. Listen to the professionals here at the Information Security, cyber threat, all the discussions, all the sessions we've had here today. There's so much to do. Try to include as much as you can into your program, and if you can, contractually.
Thank you. It's a great close. So that's it for our questions and the panelists' vision. So I wanted to introduce or open it up for questions out there. I've got a few of my own, but if anybody's got some questions about BAA and some of these issues, please raise your hand. I do have a question for Maria, though. What are some of the security requirements that are getting the most pushback for you?
Yes, so encryption is at the top of the list. Lots of pushback about encryption. Pretty much everybody accepts that they have to do laptop encryption, although sometimes we get into situations, and I've seen this, where they'll say, but we don't ever put, our employees don't ever put information, sensitive information on their laptops. We tell them not to, and so, okay, gosh, then, okay, yes, that's wonderful. So now, how do you monitor that? How do you enforce it? Do you periodically check? Do you have some assessment, some risk analysis? And then, of course, we drop into silence. So you really need to assess how much risk your organization is willing to accept. As information security professionals, we of course prefer, and compliance professionals, we prefer to say, encrypt your laptops. You don't allow any sensitive information to be moved out of the computer or systems through a USB drive. It's shut down totally. So, but even if they were to use it, they can only buy this one type, and it's encrypted at the hardware level. I mean, these are all options, right? The other one is the third-party audits. Some of the smaller companies really have a hard time with that because they have visions of very expensive audits by, you know, the Big Four or some other bigger expensive auditing company, and they just, you know, really can't pay for it, don't want to pay for it, haven't paid for it, you know, haven't built that into their business operations, and so they really need help with that one. And the other item is, believe it or not, business continuity plans. Disaster recovery and business continuity plans do exist. Organizations have them, but have you asked them if they've tested it lately or if they've updated it? And if they say they've updated it, well, then they must have tested it, because otherwise, how did you know what to update it? So these are some of the questions and some of the things that when they say, no, we don't do that way, we dig a little deeper, again, with a very consultative approach. And I've actually had, early on when I worked at several employers back, came out with this, and I had some CEOs call me of some relatively small companies and say, Maria, I'm calling to thank you. I've been able to expand my business as a result of the free risk assessment you did on us through this security addendum. Well, there were only 2 of those in my entire career, so you can imagine the others are mostly, you know, scared. They're just scared. So if you try to manage the fear that they have in a positive way, you could turn the situation around. There have been a couple of times when we've said to the business owner, sorry, you have to find another vendor because it's just been too many components that are missing from this particular vendor's operations.
Thank you. Sure, absolutely.
I wanted to talk about the fear, and I think a lot of people have fear. And but I wanted to tell everyone, if you take a look at all the recent cases that there were fines, it wasn't so much this egregious claim that happened. You know, I worked on the Blue Cross Blue Shield of Tennessee case, and everyone's thinking, oh my gosh, you know, they left this room full of unencrypted flash drives and servers, and that's why they got fined. That really, if you look at it, that's not why they were fined. They were fined for failure to do the risk assessment, failure to have policies and procedures, and failure to train your staff. And if you look at, I guarantee you almost every single one of those ones that have those $1 million fines, or even Phoenix Cardiology with the $50,000 fine, it wasn't so much the claim that happened, it was the failure to do the steps in advance. So try to calm your fears and say, you know what, I've already attended this, I know what I have to do. Just try to get those things in place.
We keep harping on process if you can't hear that. You see, data breach will happen. When I say don't overpromise privacy, you cannot promise that you'll keep the data safe. I can't promise that the government will never come knocking or you'll never be sued. What I can tell you is the better your process and the more responsible your process, the more likely that I can and have gone to OCR many, many times and said, oops, now we have new regs on some of the financial transactions as a result of some of those. But my clients didn't get fined because we went to them early. And that's true with most data breaches. I laughingly say I beg for mercy, but that's not the case. I communicate on behalf of responsible clients early and often when the concern happens, and we work together to solve those problems. And Michelle can attest at OCR, and I can tell you at Justice, that because we do that, things get better. And so it's that natural reaction from our childhood to hide in the closet when something goes wrong. Right. And it is, if we recognize that that's a natural reaction, we also know it has never gotten better when you do that. If for nothing else, when a breach happens, breach notification is actually one of the most protective things you do because it mitigates the risk. And even when you haven't done things perfectly, the process of investigation and redress, mitigation and correction, again, brings the liability down. So when you read through the Office of Civil Rights postings and Justice and all these others, which I do religiously, and I commend to you, it's very empowering. What you realize is that making mistakes happens. But if you can prevent them, that's good. If you try to prevent them, that's good. And if you show that you learn from your lessons on the OCR regulatory front, they are very gentle if you say, we screwed up, but they called me back from my honeymoon and I am here to tell you that I am here until we fix this. And it works. Now, I cannot tell you that that works with the plaintiff's bar, but what I can tell you is that the damages don't get any less by waiting, hiding, or not doing the right thing, because it really pisses off the jury.
I have a question. I'm just wondering, can we really suggest to a VA that they utilize a specific solution to safeguard the PHI when we're using a third party? And oftentimes we have VAs oftentimes we have BAs that have subcontractors, and sometimes we get into the process of suggesting, you know, you might want to use this solution or this vendor or what have you. Could we really do that and not be responsible or have a liability if something do happen, that they're pointing back at us and saying, this is what they required of us, or this is what they suggested to us.
So you're correct. So don't do it. What you have to do is give options. Let them decide. So that's one thing. The other thing is your contract is with the main contractor. It's their responsibility to manage the subcontractor. Right? So you have one entity to deal with, that relationship, and you can give examples and give options, plural. Yeah, don't dictate a
So we can
solution.
actually ask them, and what I heard, I think I heard it differently, that we can ask that BA, we have the covered entity, can ask the BA, if you're subcontracting, we want to know who it is.
Definitely.
And how are they safeguarding the PHI? We want to go that far, or are we obligated to go that far?
Well, that was part of, I think, first of all, let me answer the first question a little bit differently. I think you go back to the concept of what are you trying to accomplish. So you might choose to require certain, just like you choose to require certain conventions in terms of other data activity because you want interoperability or other kinds of things. Then when you decide that, that's part of your risk assessment and your determination. And so the ability to pass through, to have data flow, to get data when you bring it back in, when they return the data. These other things about what processes are acceptable or not and what ranges of options you allow actually has to do with the broader business purpose. The issue about whether you dictate a particular application solution or approach, minimum standard or what's adequate, or that you use a particular vehicle. To me, that issue is if it's good enough that you feel that you're going to build your platform on it, you need to have your risk assessment for that and a documentation as to why. And then if it's not good, you're just spreading the risk. So when you ask for options and they provide you with feedback about why they don't want to use it, that's another part of the process that I think is part of the due diligence to say, well, we're either not going to consider it or you look at it and maybe it strengthens your own planning internally. So I'm not as, I don't believe that you have to let everybody play in whatever sandbox they want to. And I think organizationally, there are very strong reasons for picking certain choices over the others. But if you do it in the broader context of what you're trying to accomplish, that will guide that. And then when you do your RFP or its equivalent, you need to listen to the feedback you get because oftentimes there's very critical lessons for due diligence that in your arrogance you overlook. And when I say in your arrogance, it's rarely you all because you all are already able to roll up your sleeve. But once you get legal involved, we're arrogant, we're obnoxious, and we're pushy. And so I encourage you to listen to those conversations together on the RFP responses so that you don't miss that valuable part of the input. And as to downstream, upstream, right stream, left stream, if you go to the first of where we started out today, item 1 is know your data, item 2 knows who has it, which item 3 is always know where your data is. You're responsible for picking up and bringing it home, so you need to know if they subcontract, that they're credentialed, that it's accessible, and that you can bring it home. You don't let them take it out to somewhere that you can't find it.
I think he had a question. Behind you.
I just have a little bit more of a comment because some of the assumptions I think and some of the answers have been a little bit different than some of the use cases and some of the experience that we've seen out there. So I just am interested in on your guys' take on it. So one would be, most of the organizations that I go into, their BA system is floor up from the floor up. It is not consistent. So I would say 95% of the time. So I wouldn't necessarily think that there's going to be minor changes in terms of being able to align to what the guidance is. And I could be wrong or just have a whole suite of bad luck or I'm run a consultancy, so maybe we go and find those places. The other assumption is that we're talking about a lot about impacting and influencing and actually implementing these types of changes into either the contractual or procurement process or actually into the BA contractual elements themselves. Most of the people that are accountable for risk that I'm talking with, so when the crap hits the fans, they're the ones that are getting fired, don't have the authority to actually impact those particular things. So, you know, if I go and hug one more leader who's like balling, because he or she is just like, you know, it's great to add all this stuff, but I don't have the power to do it, what do I do? And some of the feedback that I've heard from these folks and some of the successful things would be to actually create a model before you do anything of what you're accountable to do and what you're authorized to do in this BA process. And if you're not authorized to is not balanced with what your accountability is, then don't take that on. So that, and the other piece of that is, you know, I don't know if anyone else has seen this, but the last couple security leader procurement meetings that I've been in has been like an episode, you know, celebrity deathmatch. And I think a lot of it has to do with this. And just another thing that I've seen, again, it's just things I see talking to these folks all the day in this crazy security world, is that, you know, a lot of times us in security are saying, yeah, we want to go and do all these, you know, we want to impact all these things, and procurement saying, okay, great, do it. And on the security side, we don't have the resources, or we're not demonstrating the metrics to effectively be able to implement. We look like tools in front of the business because we're slowing down the procurement process, and then procurement gets the power back. So I'm only bringing this up just to keep a couple more folks from crying, you know, out there, and so my only suggestion would be, and it's just from what I've heard from these folks that really lived this, would be to just really document the, you know, the roles and responsibilities associated with this process, and look at it from your organization sphere for like a second, but also look at it from your own sphere. Because yeah, you're all in the same organization, but the procurement office has definitely got a lot different of a story than the risk office, than the legal office. You know, so I would just kind of map that out, and we've seen that be effective. So it might be a bunch of smoke, it's just, you know, prevents one more person from time and trying.
I think that if you're in a healthcare organization and the accidental subcontractor issue is going to come up, because they're going to be data housing generic data that includes those files. So in an optimal world, in these big government entities, we implement these standards in procurement, that all your contracts have to meet certain parts of things, in theory, in some way. But, you know, sometimes the politics don't work for that. And even when it does, you still have to educate to the part. But if procurement does your contracting, then procurement needs to be part of the influence team. And I don't know if Marie wants to talk about some of the different things she's done to do some of those things, but I enjoyed listening to some of her ideas about that, because the real answer with compliance, whether you're talking about this or government contracting compliance or any of the other stuff, is that if you're making it a nitpicky where everybody's not on the team, you're pushing Atlas up the hill. So the internalization and buy-in is a really, really critical part that all the paper and contracting in the world won't fix if you don't get them on board. And I know, Marie, you had some really lovely things that we should visit about. I think that would be cool to share some of that.
I'll tell you, I've implemented a security addendum every place I've worked since HIPAA first came out. And I always found a way to operationalize it through the systems that already existed. So I'll tell you a couple of different versions. At Empire Blue Cross Blue Shield in New York City, I became very good friends with the contract administration manager, because every single contract had to be processed through her. She maintained the database of contracts for the entire company. And what we did was to put a check mark, a little box on that form that required the security addendum that I created. And of course, legal counsel had reviewed it, and they said, oh yes, this looks fine. It'll solve our problem with HIPAA and some other things that we're anticipating. Because you have to remember that back then, when HIPAA came out, it was the .com craze also. And so there was a lot of outsourcing, a lot of web development, so there was a lot of risk everywhere. And so it solved more than just the regulatory compliance requirements, but gave this added sense of, we are telling the contractors what we're expecting them to do when they take our sensitive information. And at first, the sensitive information was defined as protected health information as per the law, but then later on, we extended that because we turned from a nonprofit organization to a for-profit organization. And so all of a sudden, there was this bigger awareness and concern about our marketing strategy and the changing of our logos and our look and feel and our financial statements and so on and so forth. So sensitive became much more inclusive of other types of information. We at USC, fast forward now to where I am at USC, we operationalized it through procurement, through purchasing. I have a security addendum that I worked on with General Counsel. We have General Counsel, whenever procurement has any doubt as to whether this security addendum should apply or not, they contact General Counsel. There is a list of questions that we have them ask themselves as to whether or not the security addendum is appropriate. So there are ways to get this, but you will find obstacles, absolutely. But we must try.
I wanted to, I hope I didn't confuse everyone too much. A lot of the safeguards are in place in your BAA agreements, but if you look at those contracts, I know almost everyone that I've looked at so far as a consultant, those business associates have stated that they are going to comply with the security rule. So if they're not doing it, that's a material misrepresentation of the contract. They may not have those safeguards in place and they may not be doing the risk assessment, but if they stated in their contract that they would and they're failing to, that's a misrepresentation on that contract. So I like to assume, and I know that doesn't happen all the time, that if you're going to make an assumption in a contract or a statement in a contract, that you're going to follow through with it. And pretty much every BAA that I've looked at stated those things prior to Omnibus. And then for you, ma'am, I wanted to also say if they don't agree to a specific software, because the rule doesn't state specific softwares, but to get some assurances for yourself, I would request a letter of attestation from your business associate stating that they did a kind of a mini risk assessment on the software they're using or the safeguards that they're using, and that they said, you know what, we're going to guarantee that we're going to protect your PHI because we conducted a risk assessment. And you wouldn't be out of the wrong to request from your BA that letter of attestation that they're compliant. Almost like in the PCI, in the payment systems world.
And what I found that's new to them, and some of them are just totally not educated to the point that we are, is we're big, we're LA County. And we do business with a lot of people, a lot of small vendors, and they're just not up to par. They just don't understand it. They're willing to sign it. And I just feel uncomfortable that we may have some liability knowing that these people just don't know.
Well, they can also require them to complete training, get certification. But one of the things also that a lot of my government contractors and large nonprofits do is require that people complete vendor orientation programs. And that gives you some minimal sort of thing. But bottom line, if you know they don't pass the smell test, really, there is this responsibility in credentialing the people that the HIPAA rule doesn't let you look the other way. When I was at OCR a couple of days ago, we talked about that again, and looking the other way. You can't, just getting the representations when it's clear they're not competent. When somebody talks to me and they say, oh, we're fully HIPAA compliant, and I'm going, well, I'm really impressed because, first of all, the rule just came out last week, and I haven't even figured out what HIPAA compliant is for my clients, so I don't know how the heck you can be fully HIPAA compliant. That kind of knee-jerk I'll solve it, and I really applaud you for bringing that back up because, as I said before, I'm oftentimes more concerned about the people that sign stuff, no problem, let's get going, than I am about the people that negotiate and we listen because they'll tell me what their legitimate concerns are. The other thing I would say, and this is particularly true for government and government contractors, but also people in the world of lean, is if you see someone that you think has a spark, again, Marie's comment is beautiful, you can help them grow to be better so that they can grow to be the thing that they're entitled. Just because they're not as sophisticated, we can provide some development resources for them and price that into the contract in different ways to do that. And so you can still meet your diversity and your other goals in terms of those sorts of things. But if you're choosing between inclusiveness and letting it all hang out on your data, the law and your professional obligation of trust requires you put the people first.
I want to just add 3 resources that you could use to educate yourself and your contractors. One is NIST. NIST is what the regulators use to develop HIPAA in the first place. It is chock full of wonderful, good information. It is free. Another source is SANS.org, SANS.org. They have 20 critical security controls, and you can read on their website how there's a consensus audit guidelines, and it was a collaboration of public and private sector security professionals that came up with this baseline of 20, and they have a little explanation about what each of the 20 means. You can point them to that. It is an open website that you can let them know about. And additionally, for application development, there's OWASP, O-W-A-S-P, Open Web Application Source Program, something like that. Anyway, OWASP. And they focus on all the many ways of stopping bad programming practices to develop these applications. And if you have one of those applications, what to do to fix it. It's a huge website. They have all kinds of projects going on. Again, it's open to the public. It's free.
And I would add to that, OCR's, and OCR has really started recently building off of what CMS has been doing in their compliance area on billing fraud. They've just recently started issuing some wonderful videos, which you should take, they're for free. We typically incorporate them into our training, and particularly C-level training. So when you're talking about those small businesses, they're going to be the owners, and that's going to be somebody from the government telling them that you need to be responsible, you can be accountable, we're here to help you, but you need to do it. And the videos are outstanding, and they talk about the culture of compliance as well as the rules. OCR is planning more of them, and I think they're quite good, and it can be a great opening to your training. And what can you do better than say that we got the message from the horse's mouth from the deputy director?
I think we're getting the hook now.
Yeah, we do have to wrap up here.
Thank you very much to the panelists.
Yeah, thank you very much, Pam.